Welcome to the Maternal Wealth Podcast, a space for all things related to maternal health, pregnancy, and beyond. I'm your host, Stephanie Terrio. I am a labor and delivery nurse and a mother to 3 beautiful boys. Each week, we dive into inspiring stories and expert insights to remind us of the power that you hold in childbirth and motherhood. We're here to explore the joys, the challenges, and the complexities of maternal health. Every mother's journey is unique, and every story deserves to be told. Please note that this podcast is for entertainment purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your healthcare provider for medical guidance that is tailored to your specific needs. Are you ready? Let's get into it. Welcome to the Maternal Wealth Podcast. Today, we welcome Emily Ouellet, a 37-year-old mother of 2.5-year-old twins who were conceived through IVF, a licensed mental health counselor, and works as a school adjustment counselor at a local high school in Massachusetts. The journey to having her twins was long and arduous, as she and her husband discovered they were struggling to conceive just a few months before the onset of the COVID pandemic. Welcome to the podcast, Emily.
Thank you for having me. I'm so happy to be here.
I'm happy to have you here. I would love to start off with a love story. If you would share with us how you and your husband met.
We met, actually, it's your cousin's birthday.
Okay.
My best friend and your cousin Caitlin was dating my husband's best friend when they were in college. He got invited to her birthday as like a kind of Hail Mary from the friend, so like he wasn't alone. And then we met and we just kind of hit it off as friends. And my friend Caitlin just encouraged me that he was like a really good, sweet guy, like kind and caring and honest. And he proved to be that. And so we kind of had that 2000s romance where it was a Facebook Messenger romance to start. And then it went to texting, and then the rest is history.
How long have you been together now?
8 years married and like 12 years, 13 years together total.
So you two got married and then you decided to settle down and you wanted to have kids. Talk us through that.
Yeah, so we got married. I was 29. My husband had just turned 30, and I really was like excited to start a family, but we were renting at the time, and my husband's just so practical. So he was like, we got to own before we can have kids, blah, blah, blah. Luckily, it only took us like a year after getting married to buy, but then, he was still a little hesitant once we moved in. So 31, 32, and then we started to try, and I was having really inconsistent periods. Like I came off birth control and was getting a period anywhere from 28 to like 45 days. It was really strange. And my OB/GYN at that time wasn't super concerned. She just kind of was like, oh, it's fine. It's normal. Like you're probably just anxious. And I kind of was like, well, there's, I know I have anxiety, but I don't think that my irregular cycles are anxiety based.
Mm-hmm.
So after several months of trying and feeling like, these cycles weren't normal, like things weren't lining up, I reached out to a fertility clinic and we had an initial consult. I think that happened in like December 2019. And we started with the testing, which ended up being really overwhelming. The labs were fine, but one of the first exams when they try to see if there's any blockages in your fallopian tubes, that procedure for me was really painful to the point where I nearly passed out on the table. It just was excruciating for me, which should have alerted us that there was something up with my cervix. So then I ended up going to another clinic. We got the ball rolling, and then the pandemic started. And so we kind of had to pause on treatments, and we were just doing Clomid cycles to try to get pregnant. So taking Clomid to induce ovulation and timed intercourse, hoping to get pregnant. I think we did about 3 cycles of that. And then we were like, yeah, this isn't working. So then we started down the road of IVF.
I want to circle back to the exam that they performed to see if there was any blockage in the fallopian tubes. You mentioned that was super painful. Did they give you any medication to help with the pain prior to the exam? Can you kind of just talk us through what the exam is like and kind of pain management? Because that seems really intense.
Yeah, it was. So I was informed that it could be a little painful. They said to take ibuprofen, like I think 30 to 60 minutes prior to the exam. It was actually done on an x-ray table because once they put the dye in your uterus and it goes through your fallopian tubes, they're monitoring it via x-ray. So not a super comfortable slab to be lying on, not even a bed. And my doctor just like kept trying to get the catheter through my cervix. And I was nauseous. I was in pain. I was crying. And she was incredibly empathetic, but there was definitely no warning that it could have been this painful. She, I think, made 3 attempts before calling it. Because I was just in so much pain and she could not get that catheter through my cervix.
Were they able to get results from the exam or they called it in?
They called it. And so I ended up having, I want to say, like motherhood, my memory is so foggy. We might have done this twice. And I feel like there was one of the versions of it, they gave me something to help soften the cervix or help like open the cervix a little bit. Or dilate, I should say. But I ended up having to do this procedure with the fertility clinic because they just are more skilled at it. And my OBGYN just did not want to, do no harm. Like she did not want to make this any worse for me than it already had been.
When they did the procedure with the fertility clinic, how did that go?
It was painful, but it was manageable. I think I ended up bringing my mom that day because my husband was busy and I knew I needed a support person. So my mom kind of came in and the provider that did it was so kind and took her time and helped me breathe through it. And just, I think it's different when this is your specialty. And she was able to help me get through that. And we were able to confirm that fallopian tubes were not an issue. No blockages there.
In the fertility clinic, what kind of bed were you on?
It was more of an exam table, like at a typical OBGYN office.
Okay, so not an x-ray slab table.
Yeah.
IVF treatment in COVID, how did that look for you?
It was a really lonely experience. My husband was in the car for almost every bit of it. I was going in for lab work with a mask on, going in for procedures alone. We did 3 rounds of retrievals with our first clinic. The first retrieval resulted in 1 viable embryo. And then I had a similar experience actually when they transferred that first embryo. It was just on an exam table. And again, the catheter going through my cervix was very, very painful. And I had a male physician for that procedure. And I just felt like very invalidated by him and my pain. He kind of just was like, you got this, like, this is normal. And it did not feel normal. So not only was I in a lot of pain and alone, but that transfer did not end up working. So it was really hard. It was really emotionally heavy and lonely.
I can't even imagine going through this and then not being able to have at least one support person with you by your side during this experience.
Yeah, there were a lot of hard moments, and that first transfer that didn't work resulted in needing a DNC because my beta HCG hit a number that was like we knew it wasn't a viable pregnancy, it was a chemical pregnancy. But unfortunately, like the number kept rising. So they had to perform a DNC to make sure that there was no tissue hanging on, to make sure that I could continue on the process of trying to get pregnant. And that, was also a really sad moment where I was in there by myself, getting ready to go to a DNC. And I was like getting tearful and emotional, and the nurses were really kind with me. And I'm like, should I be upset right now? Like, is this just a procedure or is this more than that? And so, that was just so sad.
For the DNC, did they prepare you about what the procedure was going to look like and how it was going to be?
Yes. I definitely felt like by the time I was with the fertility clinic, aside from that transfer with the male physician, there was a lot of prep and the nurses were wonderful. And they all gave me a lot of information leading to, and the anesthesiologists were also really wonderful. I felt like in good hands, but I think just mentally the weight of knowing that it was a DNC was heavy.
Was the DNC performed at the clinic or at the hospital?
At the clinic.
Then the first one, it didn't take.
Mhm.
What was your plan after that?
I was pretty determined, and so we then did another retrieval as soon as we could once my beta HCG was down to 0, which did take some time. We did a different protocol for IVF that second retrieval. I went in, I think that one was right around Thanksgiving, and no embryos. We did not have a single viable embryo. So all of those meds and all of that prep, and they retrieved no embryos, and that was devastating. And then we did a third cycle with that clinic, and the doctor kind of went back to the same protocol from round 1. And we were trying to trust the process and her expertise, but the first cycle only got us 1 embryo, the second 0, but like 1 embryo at my age without, no reason to think I had diminished ovarian reserve or anything like that. That's not a great outcome. Usually with IVF, you expect a few viable embryos from a retrieval. So we were a little bit reluctant, but trust the process. But then again, we only got 1 embryo from that retrieval. And that retrieval, because my progesterone spiked afterwards, insurance makes you do a fresh transfer if you're not planning to test the embryos unless something medically complicates it. And we didn't have the finances to test our embryos, especially when we were only getting 1 at a time. So we were going to do a fresh transfer. But then when my progesterone spiked, we had to hit the pause button, freeze that embryo to get my body in the better spot for a transfer.
Mm-hmm.
And that's when my husband and I were like, we're going to switch clinics. We're just repeating the same thing and expecting different results. And this is heartbreaking and exhausting.
Yeah.
So that was when we switched to Brigham and Women's, which is one of the kind of leading hospitals in Boston. And we had friends that had done IVF there. And we felt like their experience sounded much more hopeful and positive. It's a teaching hospital, so there's a lot more eyes on complicated cases, which mine was starting to become a complicated case because despite having no reason for it, I wasn't producing mature eggs at these egg retrievals. We did 2 more retrievals with them. I think we ended up total with 7 embryos. We did a fresh transfer after the first retrieval with 2 embryos because at that point, the data and the statistics said like, okay, time to increase our odds here when we transfer because she's not having success. That transfer failed. We did another retrieval, got embryos, froze them, and then our final transfer was a frozen transfer, and I did it under anesthesia, so there was no pain, and that's when we got pregnant with our twins.
We paused this episode for a quick message from our sponsor. At Maternal Wealth, we aim to ensure that you have access to the best and the most appropriate care. That's why we created a maternal healthcare provider database. Maternal health providers can easily create profiles to promote their services and business, helping to increase access for those seeking their care. This is a one-of-a-kind database that offers a new and exciting way for women to search for and find maternal health providers near them and tailored to their specific needs. Profiles feature badges that highlight various services such as TOLAC-friendly practices, all-female practices, LGBTQAI+ inclusivity, language options, access to vaginal breach services, and more. Additionally, be sure to check out our Not Your Average Birth course. In this course, I discuss the variations that exist in hospital practices based on policies, staffing, and budgets, all of which can directly affect your birth experience and outcome. Amazing. When you were doing the transfers at Brigham and Women's, were you able to bring a support person?
I was able to bring a support person. Well, Joel came in, my husband came in for the beginning part. He didn't stay in the room with me because I was under anesthesia, but he was there in pre-op. But then when I woke up, he was not there. He was in the car waiting for me to be cleared by the nurses. That was not as bad as the other clinic, but that was still hard. You want your person to be there when you wake up.
Mm-hmm.
You want that reassurance. And I think even when the doctor informed me we were doing a double embryo transfer, I think at that point Joel had already been sent out to the car in the parking garage. So I had to then share that news with him over the phone, which was a little bit jarring for him to digest sitting in a car, but it worked out.
Talk me a little bit through the process. So they do the double embryo transfer, and then what do? Do you wait a little while? How does that work?
Yes. So I think it was at least 2 weeks of waiting. And then I went in for blood work for an HCG test. That test came back obviously positive. 48 hours later, it went back for another one to make sure that my levels were rising appropriately. They had quadrupled. So then, the little voice in the back of my head was like, you might be having twins. But I've also heard that like HCG levels can just jump up at these wild intervals and not mean anything. And then I think there was 3 of those blood tests, and then we had to wait for an ultrasound. And so Joel was there with me for the ultrasound the whole time. So we went in, laid on that table. And she put the ultrasound just externally at that point. It was going to be an internal one, but they start externally. And already we saw those 2 heartbeats. Like they were right there. And it was very clear that we were having twins from that moment on.
What was the first thought that you had when you saw 2?
It was a mix of like joy and panic. Like I was like, uh-oh, like were we too risky in transferring 2 embryos? Was that crazy of us? But like, oh my gosh, we get to have 2 babies. I felt really lucky.
How about Joel? How about your husband?
I think the panic was a little bit more than the joy, but there was joy. We were both crying. The tech left the room for a second because then she needed to let the lead radiologist know that she would be performing an ultrasound for twins. I think she just needed to run things by the doctor before she continued. It was kind of nice because we had like a moment where we were just like soaking it in. I mean, we were scared, but just so thrilled.
How long did you wait to tell family and friends?
We told a lot of our close family and friends right away with the blood test that we were pregnant because this process, I was very transparent about it. I talked on social media about it, and that's how I coped. The people close to us knew that we had a positive blood test and that we were pregnant. But I looked at Joel on the ride home and I said, let's save the twin surprise for Christmas. And he was like, yeah. And I was like, yeah, I think I want to surprise our parents and grandparents with that. So that's what we did. We waited until Christmas time to surprise our family and friends that we were having twins.
Did you tell them verbally or did you do a little gift? How did you let them know?
So we had our parents together for a little like pre-Christmas gathering, and we gave them an ornament and a picture of the ultrasound. And the ornament said, "Let twins coming July 2022. It's funny because my mother-in-law is a nurse, so we assumed she would be the first one to pick up on it. But I think it ended up being my dad that like was like, wait a second, like they didn't read the ornament well enough, and they didn't really look at the ultrasound. But my dad was like, wait a second, and then everybody realized it. And then on Christmas, Joel's grandmother, I think it was 2021. So we were still a little bit in kind of some COVID times. And so we weren't physically with Joel's grandmother. So we FaceTimed her on Christmas, and we had someone have a gift for her with the ultrasound picture. And she's really important to us. She's just the matriarch of his family. And she is a retired labor and delivery nurse herself. So she's been just a huge support and advocate. So telling her, and she had lost her husband in the year before that. So it was a really special moment to tell her.
Do you know where she worked as a labor and delivery nurse?
Holy Family Hospital up in Lawrence.
That's so sweet. I'm sure that was so special for her and for everybody.
Yeah. Not to fast forward, but when she came to visit me at the hospital after we had the twins, she came over and she was like putting lotion all over me and like taking care of me. Like you could tell that she was such a good nurse back in the day. And it's like when you have your baby and people come to visit, they're like, oh my God, the baby, like people and always remember that the mom has just experienced birth. But she took such good care of me the day she came to visit. And I was like, oh, you're an angel.
So sweet. I'm just picturing this elderly woman putting lotion on you after you had a baby in the hospital. That's so sweet. Oh my gosh. That's so special.
It is. Yeah. We feel really lucky.
How was your pregnancy with twins? I know you've only been pregnant with twins, but how did that go for you?
1 pregnancy, 2 babies. Honestly, I feel pretty lucky. I really had a decent pregnancy considering I was carrying twins. The only day I got morning sickness was actually the day after the transfer. And I think that was like the anesthesia giving me a migraine. I had nausea, and heartburn every day, but I never had morning sickness. I stayed active for the first maybe half of the pregnancy, and then it, definitely slowed me down. The hardest thing about my pregnancy, I got gestational diabetes diagnosed around 28 weeks. That was just obviously mentally challenging more than anything because I was managing it with diet, which luckily, again, I didn't need insulin, so that was great. But I definitely had to really change the way I was eating, or at least be really cognizant of the way I was eating. I made it to 38 weeks, which was the goal. But my last month of pregnancy, I got put on leave from work. I had a bout of hypertension when I went to one of my visits, and my doctor was like, okay, we're done now. We're done working, which was actually such a blessing. I was pretty ready to be done with work at that point.
While you're pregnant, did you continue on with the OB that you had prior, or did you go with a new OB?
So it was interesting. I was starting off with a new OB within the clinic, just because I met her for one of my first visits, and I liked her. She was really like bubbly and nice. As things progressed, timelines and different reasons, I ended up actually back with my OB from prior to IVF. And it was actually like a really healing experience because I got to see her and say, I know the last time that we kind of interacted was this really awful procedure, but I don't hold any hard feelings. I am still very grateful for you. So she ended up being the one that delivered my twins. And in hindsight is a really good decision because the birth was a little bit complicated, and she was just like really good hands to be in. She was very kind of like bright, cerebral, like to the point doctor. And I think that's what I needed when things got a little scary.
When it came time to deliver, when were you planning on having a vaginal delivery, or were you planning on having a C-section?
I decided about halfway through my pregnancy, I wanted to do a C-section. My twins were oriented transverse, kind of like in bunk beds. And so my son was almost, until the day we went to have our C-section, he was never head down. And then my daughter just kind of like hung out cozy up top, like transverse. And with the cervical issues I had, actually, I missed this piece. I did end up having a surgery on my cervix during IVF to get rid of a ridge that was in my cervix. So there was something that was complicating all that. And I just was so fearful that that was going to make birth hard. And I didn't want to get in the headspace that I was going to have a vaginal birth only to then need a C-section. I just wanted them to get here safely for all of us.
I think it's so important what you're saying, to honor and recognize our intuition when it comes to our bodies, and that we know, like we just know, and to recognize it and honor it and proceed in a way that's safe for us, especially during pregnancy. Even with my patients, I always tell them, like, you know your body, you know your baby more than anyone, right?
Yes.
We're here to guide you. So it's great that you listen to that.
Yeah, it was interesting. I've talked to other moms about this, and it was like, at what point I thought my doctor was going to suggest a C-section, and it was kind of like I brought it up first, and then she totally validated and agreed with my decision, but I didn't really know how that would go. I think that's like one of those misconceptions about like going into motherhood, especially with multiples. Like you assume that you're going to be told you need a C-section, and it's going to be scheduled because of, X factors. And they were waiting on me at that point. It was still early. So they were I got to make the call because it was so early, but I was glad I did it. And it was, she supported my decision the rest of the way through. It was a huge weight off my shoulders once I decided we're having a C-section and we have a date scheduled. Although I never thought I would make it to 38 weeks. That was wild.
So did you plan for a C-section for 38 weeks?
Yes.
For your surgery, did they schedule in the morning, in the afternoon?
In the morning, but I think I got there and were waiting for a little while because there was another complicated case that day. So we got pushed back. Like, I think I was maybe like the 9 or 10 o'clock, and I didn't get into the OR till like the 11 o'clock time.
This happens all the time. So I always try and tell people, if you're going to have a scheduled procedure,
Yep.
Try and do it as early as you can because you never know what's going on. And sometimes I'll have patients coming in for a scheduled section at 1 in the afternoon and they're not getting done until 5 o'clock and you're not supposed to eat until
Oh,
like right midnight before, and then you're all day and it's just like a whole thing.
yeah.
So you were scheduled for around 9. You went
Mhm.
in around 11. How was the pre-op when you go into the OR? What that was like for you?
Yeah, so we got set up in a room. They did that final ultrasound in the pre-op room before, and just to check like the orientation of the babies. And that was, of course, the moment where my son was finally head down.
Of course.
Quick moment of being like, but I was set with my decision. I remember they got me set up with an IV and kind of talked me through stuff. My husband got ready in his little bunny suit. Then I believe they walk you down. You would know better. I think I walked down to the OR
Mm-hmm.
by myself because they want to do the epidural, yes, before your partner is there. So went in. I actually surprised myself that I handled getting the epidural placed pretty well. I thought I was going to just be so uncomfortable and so scared. That was fine. And then my husband came to join me. I did say to the anesthesiologist, I definitely have some anxiety about obviously having a C-section, being awake while I'm being cut open. I know my brain and I'm going to go into a place of like I know what's happening to my body right now, but I didn't want to be sedated. I was like, I know I have a pretty strong like vasovagal response in these moments. So
Mm-hmm.
the anesthesiologist was so awesome. He was like very chill and relaxed. And he was like, okay, I got you. Like, don't worry. And then during the start of the section, I did get a little like nausea. And he quickly just put something in and he's like, you feeling better now? And I was like, oh, I am. And he's like, yep. So he was really chill. He was really good. I had a regular drape. I did not have a clear plastic drape because of that like kind of anxiety and like squeamishness. I just remember like hearing that first cry and then, my husband went over to what is it called? The care team.
Yeah, the neonatal care team. Yeah.
Yeah. So he went over to the table with them and saw our son and cut the cord. And then after the fact, I found out that the resident with my doctor was the one pulling the babies out of me. She came into our room and said, I'll never forget you guys. You were my first twin delivery. And I was so excited for you guys and being a part of this that Dr. Sherman, my doctor, had to call her back over and say, you have another baby to pull out. Although they were only 37 seconds apart. So it wasn't crazy, but she was just so caught up in like the joy of the whole thing. So they both came out healthy, awesome. They were perfect. And I remember that anesthesiologist, he was a very chill guy, kind of like bro-ish. And he was like, those are really beautiful babies. He's like, and trust me, like I would not comment if they weren't cute. So like very matter of fact. They went down to the room that we were in pre-op with my husband while I got stitched up. And I managed that well, but a little while after I got to the room, I was having some pretty heavy, well, I was during the section. And then when I got back to the room, pretty significant bleeding. And then I had some nausea, vomiting, which was really rough. So it was a little bit stressful for the first few hours after they were born because I had lost a lot of blood and I was also vomiting. And, we were, is she going to get a blood transfusion or like kind of just like touch and go a little bit of what we were going to do for a few hours.
Did you end up needing a transfusion?
They ended up deciding not to do the transfusion. I finally stabilized and they decided that we were going to do a couple iron transfusions during my stay.
Okay.
Which is like obviously the slower road to feeling better when you've lost that much blood. But I've heard different things about having a blood transfusion. So I feel like it ended up being the right thing. And my doctor stayed on through that time. She stayed and made sure I was stable to go up to the floor.
Oh, okay. So you stayed on labor and the recovery for a while.
Yeah.
As you recovered, then you went to postpartum.
Yeah. The twins were healthy. They were wonderful. I was a little sad because my first attempt at breastfeeding, like that's when my first bout of nausea and vomiting happened. So I was like just latching my son and like figuring it out. And then I was like, I'm going to be sick. So I quickly had to like hand him to a nurse. So the first 24 hours was tough because I was just so depleted and really wanted to breastfeed, but also was like in a lot of discomfort and really weak and nauseous and just struggling.
think at the hospital that you delivered at, they have a nursery. Did you utilize the nursery while you were there to get some rest, to recover?
Yes, I definitely utilized the nursery. They were very supportive of us doing that. And it's funny, similar to like the question about like C-section versus vaginal birth. I think the second night we were there when we decided to utilize the nursery, it was awesome. The overnight nurse came in and she was like, all right, like we keep it real here. Like you have a few days with us and then you're off on your own. Like you need to use us to the most you possibly can. So how can we give you rest and take care of you before you go home and you don't have us anymore? And we were like, well, like really tired. Like I was having like, I had an air bubble that was in my back from the section. Like that's where it was like settled. So when I would sit up to try to breastfeed and I had to feed two babies, the sharp pain of that air bubble was making me nauseous. And so I was like feeling like it was hard to learn to breastfeed while I was in so much pain. And my husband was just like, are we able to like talk about formula? And the overnight nurse was like, yep. She was like, I'm so glad you brought it up. Like you came in here saying that you wanted to breastfeed. So, we can't introduce formula unless there's a medical necessity. But now that you've asked, ask and you shall receive. So the babies went to the nursery for a few hours overnight and they got formula and I could rest. And that was huge every night.
I love hearing that because I've worked in hospitals where we don't have a nursery. And I think it's so imperative for, not for everybody, but families who need it, who need the time for the first couple of nights for moms to recover. And
Yes.
it's so important in promoting a healthy recovery, physically, mentally, spiritually, to have that nursery, to have that option.
Yeah. I had friends that were like very strongly encouraging me to remember to use it when I got there. They were like, before you go to have your babies, there's no shame in using the nursery and like you really should. And so we went in with that support from like, different people in our lives, but there was no way I could have recovered without that. I can't imagine. I was so physically depleted in so many ways.
Yeah. And also thinking you have a partner, you had your husband, and he is emotionally, physically exhausted also because he's a new father. Watching you, his wife, go through everything, it's exhausting. So
Mm-hmm.
I'm very pro having a nursery.
Yeah, I can't imagine not having that at all. And because I was so sick the first 24 hours, he was swaddling, diaper change, like he was doing it all for the two babies when the nurses weren't doing it because I couldn't stand. I didn't stand up until the second day I was there, which I know isn't the norm after a C-section.
How long did you end up staying in the hospital before you were discharged?
Well, this is another interesting like curveball of the story. So we were supposed to stay 5 days and typical recovery, and that was normal. The babies were great. They were passing every test that they had, and they didn't have any complications, thank God. But I ended up getting halfway through our stay a GI bug. And so I then was even more sick on a different level. So like just as my appetite was coming back, like post nausea and anesthesia, I then got a GI bug. So we ended up being there for 6 days for my recovery. Like even the pediatricians that were circling, like it was just as much his recommendation as it was the OBGYN overseeing my care. So we were there for 6 days. When I got that bug, that's when I started pumping because I just, between like that pain in my back and like the nausea and everything, I knew I couldn't sit with both of them on like learning how to breastfeed while I was so sick. But I wanted to make sure I was getting my supply to come in. So I started pumping during that time. And then my husband and I were like, maybe, well, I decided, of course, but he was supportive. Like maybe I'll be an exclusive pumper and I will just pump, divide what I get, and supplement the rest. And we felt really good about that as like our game plan, so that we felt like we were still giving them breast milk, but it wasn't fully on me to feed both babies every feed. That illness and that curveball like set a different part of like our postpartum journey that I was going to be a pumper.
How was the transition home?
Transition home was really nice. When we literally drove home, and there was a funny thing. So we have a dog, and he was our baby during COVID and infertility. And as we were leaving the hospital, our dog walker merged into traffic right behind us. So we drove home, and were immediately greeted by our dog, who had been being brought home, like the typical, like bringing home cloths and different things from the babies. So we got to introduce our dog to our babies, like with our dog walker, a safe person to him. And it was a really beautiful homecoming. And my mom also met us at home to help get in the house and stuff. But it was definitely really nice to get home and into our own environment. But our house, you have to walk upstairs to get to the main level. So once I got to the main level, it was like, okay, this is where you'll be. So I was between the couch and then a bed in the guest room for the first 2 weeks. And we just were just feeding babies and just keeping them going for 2 weeks.
How was the physical recovery after having a C-section?
I would say I had a middle of the road experience. Like I said, I think I didn't get up as soon as I wish I had because of that blood loss and that, nausea and vomiting. So I think my recovery was a little slow, and they were born in June. And so the heat of the summer, I ended up getting an infection on my incision just because of like the heat and the sweat and just like all of this stuff. So that was a little hard. But after a little while, it got better. Like, it wasn't horrible. And we definitely, as soon as we could, took walks around the neighborhood and I moved. That post-op infection was just a little bit like oh, what the hell? Like, after all the things that had happened. And I was so overtired when it happened too. Right when I got that infection, I also got my first round of mastitis. So I was just so sad and grumpy.
Everything was just thrown at you.
Yeah, it was wild.
If we have any listeners who are just finding out they're having fertility issues and are not getting pregnant, what advice would you have for them?
I think that you need to really be a big advocate for yourself. I think you need to ask for your OBGYN to do day 3 labs, which are those initial like fertility workup labs that show kind of where you're, at least on paper, like what your fertility looks like. A big part of my fertility journey was advocating with doctors, with nurses, with insurance companies, just like pushing for, again, just like your body and your baby when you're pregnant, when you're trying to get pregnant and something seems off, like trust that intuition, trust your gut. And unfortunately, our health system in the United States is dictated more by insurance than it is by patient care. So you're going to have to fight for what you need. And that's okay. No guilt, no shame. Like, yourself.
Looking back at your whole experience from the beginning to where you are now, what are you most proud of in yourself going through that experience?
I think that I really fought for these babies to be here. I knew I wanted to be a mother. I managed my way through my husband's uncertainty, and I fought so hard for these babies to be here and be healthy. Before the gestational diabetes diagnosis, I was reading a book about being pregnant with multiples, and it really was like nourishing your body and getting enough fuel to carry healthy babies. And I gained the weight that it was healthy for me to gain to carry twins. Like, I did everything in my power to bring healthy babies into this world. And I'm so, so proud of that.
How are Jacob and Lucy doing now?
They are hilarious. They're 2.5 and they are very talkative and very opinionated. They're thriving. They have their moments with each other and with us, but they are very typical 2.5-year-olds, and they're really sweet. They have a great little brother-sister relationship. We're in the process of debating whether or not in the fall when they're 3, do we do 2 years of preschool or 1? I think they could go either way. So we're just trying to decide about that, but they're awesome.
Is there anything else that you would like to leave with us before we end the episode?
I think something that I experienced postpartum was definitely like postpartum anxiety, which shouldn't have surprised me because I have anxiety leading into this. That's just kind of my makeup. But I definitely think it presented itself a little delayed, closer to me going back to work. And I talked to a lot of my coworkers and moms that I know about normalizing that postpartum anxiety and that it doesn't necessarily have a set timeline. And I really struggled with some really intrusive thoughts and fears about them when they were with another care provider, once I was not their primary care provider. And, as a mental health counselor myself, I definitely minimized my own experience for a long time. Getting a therapist on board as soon as you can, either when you're pregnant or like lined up for postpartum, is so helpful, because in your own mind, when you're overtired and struggling, like you can't weave your way through these thoughts and these fears. So having a provider and a support network is so important. It's absolutely vital.
Speaking of therapists postpartum, there's a lot of therapists now who you would know more than I, but they specifically are trained and specialized in perinatal mental health.
I think when I went through my IVF experience, I thought about there being a point in my career where I did some private practice work within infertility and perinatal and things like that. It really is a specialty. In my journey, I actually have a therapist that I started with a year ago, but in my journey to get with her, I saw a therapist that, and no shade to this woman, but perinatal was not her specialty. And I just did not click, because the experience that I was having, you need to have someone who understands that process and the different things that can come up. So we have a lot of access to providers now with telehealth. And there's a lot of different ways you can search, either through your insurance company or a website like Psychology Today. You can narrow things down and click by perinatal female therapist in your area. You can really find that right person.
Absolutely. I think that's really important to highlight the perinatal mental health specialty, because like you said, it's a unique experience that someone who's going through it needs the specialized care.
Yeah, absolutely.
All right. Well, thank you so much for taking the time and sitting down and chatting and opening up about your experiences.
Thank you. I'm so grateful that you're doing this for other moms and women. It's such a need for us as women to lift each other up and share everything we know with one another. Like, Maternal Wealth is the absolute perfect name for this.
Thank you so much. Thank you for listening. Be sure to check out our social media. All links are provided in the episode description. We're excited to have you here. Please give us a follow. If you or someone you know would like to be a guest on the show, reach out to us via email at info@maternalwealth.com. And remember, stay healthy, embrace your power, and you got this.